Do you feel overwhelmed whenever you try to understand the various technological tools being utilized in the management of type 1 diabetes? Do you ever wonder how, over the decades, technology has entirely revolutionized the lives of people living with type 1 diabetes? Then, you will find the answers to your queries in this interesting short film. Watch till the end. Hello, friends! Probably type 1 diabetes is one such unique condition which has witnessed the entire cycle of technological advancement in its management, just in the short span of last 100 years. In this film, we will talk about the evolution of technology in the management of type 1 diabetes, and also understand the key concepts and terminologies related with the various technological tools used at present. To begin with the past, though there had been some mention of the disorder resembling diabetes across all ancient medical scripts, the formal understanding of diabetes as a condition with dysregulated glucose metabolism was documented about 200 years ago. Almost 50 years later, it was identified that pancreas and insulin deficiency are somehow related with the origin of this condition. However, the fate of all those identified with this condition was a painful and certain death in next few weeks or month. Almost 100 years ago, the first successful attempt to isolate insulin from cattle and pig for utilizing it in the management of those living with type 1 diabetes was contemplated. Once the life-saving nature of this therapy was established, next several decades witnessed further refinement in insulin production from purification of the raw animal extracts to availability of unlimited supply of premium quality human insulin with the use of recombinant DNA technology. Simultaneous research observations indicated the need of modifications in insulin structure, thereby producing longer-acting and shorter-acting insulins, which could be utilized in different combinations in order to mimic the natural round-the-clock metabolic machinery. However, with improving understanding of the condition, soon it was realized that insulin administration is neither safe and nor effective in achieving therapy goals if done without keeping a close watch on blood sugar levels, giving rise to another aspect of management with a vast scope of technological advancement, the blood sugar monitoring. The vast majority of further technological advancements in type 1 diabetes management is related either with insulin delivery systems or glucose monitoring systems, which we will cover one by one in next few minutes. The earliest commercially available insulins used to be packaged in glass vials to be administered using regular syringes. Soon, special insulin syringes were designed, which carried markings as units rather than volume, helping users to quantify the correct dose to be administered. Meanwhile, the regimens evolved from initial twice-a-day split mix regimen to multiple dose injections in form of basal and bolus cover of insulin. Although the vial and syringe system was inexpensive, the inconvenience associated with its cumbersome use gave way to the introduction of insulin pen devices. With these sleeker delivery devices carrying insulin stocked in a cartridge, much finer needles, and easy dose titration with smooth dial systems, they were very widely accepted by the users worldwide and are still being used everywhere, especially in the regions with limited resources. Since the closer replication of natural glucose metabolism regulation required insulin to be delivered continuously instead of intermittent delivery with syringes or pen, the concept of insulin pumps saw the light of the day just only a few decades ago. The earliest forms of insulin pumps were meant to be portable mechanical devices, carried over one's body with a power battery and a pump to infuse the stored insulin through a subcutaneous cannula in predefined hourly rates. Further refinements brought the concept of a parallel infusion of continuous basal insulin, with provision of giving intermittent boluses for covering meals and as correction doses. As per the specific requirement, the bolus can be regular, extended, or a dual wave bolus with both characteristics. taking the decision on pump functioning as per the data obtained from simultaneously applied continuous monitoring, termed sensor-augmented pump, was found to deliver better blood sugar control. In its further refinements, in order to limit the possibility of severe hypoglycemia episodes, automatic basal insulin suspend function was introduced in these pumps in response to low blood glucose reading or trend shown on the integrated glucose monitoring device. These features are popularly termed low glucose suspend, that is LGS, or predictive LGS, respectively. The latest set of advancement in the insulin delivery is automated insulin delivery, also called as closed-loop system or artificial pancreas, which connect the pump functioning with the readings from continuous glucose monitoring system with the use of an algorithm which aims at keeping the blood sugars within a certain range across the different physiological conditions like eating, sleeping, or exercising. Short of complete automation, certain devices categorized as hybrid closed-loop systems require certain amount of manual intervention, especially for covering unexpected meals or exercise spells. Friends, there is enough evidence over last several years of research establishing insulin pumps as the preferred form of insulin delivery devices in the management of type 1 diabetes across all ages of users. Use of pumps has been shown to help achieving the desired therapeutic goals, minimize the risk of hypoglycemia and ketoacidosis, prevent long-term complications, and improve quality of life of everyone involved in the care of people living with type 1 diabetes. Despite a small set of users reporting physical inconvenience, overwhelming technical demands, and unpredictability in its use, the benefits of using pump devices are convincing enough for worldwide professional societies to advocate its use for better outcomes. Recently, connected pen devices are also being developed which give the benefit of automated algorithm-based insulin dosing without need of continuously carrying the device on one's body. Next, take a look at the advancements in the second important aspect of type 1 diabetes management, the glucose monitoring systems. The earliest form of monitoring, introduced several decades ago, was in the form of urine sugar monitoring at home through the Benedict's test, using the conventional laboratory burner for boiling the mixture. Subsequent refinements introduced color matching based urine testing for reducing substances and ketone bodies. The portable capillary blood glucose monitoring devices gained exponential popularity soon after their introduction and have been guiding the insulin dosage titration process till date. These devices are based on electrochemical processes, and it is recommended to use those with approval from International Organization for Standardization and Food and Drug Administration for reliable quality control. Recently, few devices have been introduced which can measure both blood glucose and ketones through different test strips on a single finger prick sample. The major advancement in the glucose monitoring systems was introduction of continuous glucose monitoring systems. These are body-worn portable devices with a fine sensor which measure interstitial fluid glucose levels through glucose oxidase method. Various available devices offer sensor life between 7 to 14 days, after which there is a need for replacement. These devices may be recording the data continuously, as in real-time CGM, or there may be a need to scan the device intermittently for transmitting the readings, as in intermittent scanning CGM or flash readers. The various monitoring metrics generated by these devices, like time in range, time above range, time below range, etc., are used along with glycated hemoglobin to make clinical decision related with insulin dose titration. Apart from technical failures, interference with certain medications and local skin rashes, financial burden and technological demands remain the key hindrance towards their use. However, especially in integration with insulin pumps, these devices too have a proven track record for improving the outcomes of type 1 diabetes management across all ages. So this was the summary of various technical advancements in type 1 care so far. However, the advancements are ongoing, and as we are talking, several new aspects of it are being explored and will soon be available for use, hopefully. Some of the examples are newer insulins, which can be taken through other routes than painful injections, stem cell transplant, and better pump algorithms, which ensure more precise glycemic control. Well, at the end, let's not ignore the elephant in the room, too, which is the mighty AI. Yes, the use of AI is transforming the world faster than an average end user can even imagine. In the arena of type 1 care, there certainly is a vast scope of its use, from instant photographic carb counting based bolus calculations to the insulin dose modifications based on feedback data from wearable fitness devices. The possibilities are endless. How about you share your unique ideas about use of AI in type 1 management in the comments? Who knows? If your imagination is interesting enough to tickle a scientific mind for next breakthrough discovery, I will be happy to read them all. Meanwhile, stay informed, stay safe. Take care. Bye-bye.